Hi, I'm Dr. Joss Fernandez with Missouri Heart Center. The prospect of having heart surgery can be a confusing and scary time. Understanding the process may help ease anxiety.
Your heart is responsible for pumping approximately 1.5 gallons of blood throughout your body every minute. This provides oxygen and nutrients to your tissues and takes away waste. A normal heart beats 60 to 100 times a minute. Just in one day, your heart may beat over 100,000 times, in a year 40 million times, in a lifetime over 3 billion times. With all the pumping, your heart muscle needs a steady supply of oxygen and nutrients. These get to the heart from the aorta by way of coronary arteries. As we age, cholesterol and plaque can build up in your coronary arteries, keeping blood from getting to your heart muscle. Plaque in your coronaries can break loose and cause a sudden heart attack, or build up over time and give you chest pains. When individuals have multiple areas of blockages or an area where a stent may be difficult to place, coronary artery bypass surgery is needed. This is done by opening the chest in the center. Generally, your heart will need to be stopped so that the surgeon can work on it. While your heart is stopped, blood from your body will drain into a pump, which will provide it with oxygen and remove carbon dioxide. The pump will then push blood back into the aorta. While your heart is stopped, the surgeon used vein that was taken from your leg and sew one end to the aorta and the other to the blocked artery beyond the blockage. This is called the coronary artery bypass. There is also an artery behind your breastbone that makes for a good bypass and should be used as often as possible as one of the bypasses. The number of bypasses varies from person to person depending on the number of blocked arteries and where the arteries are blocked. Typically, people have either triple or quadruple bypass surgery. Now that we have plenty of blood going to the heart muscle, let's take a look at the inside of the heart. There are 4 check valves in your heart that keep blood from going the wrong direction. The first of which is named the tricuspid valve. This keeps blood from the right heart chamber from going back into your veins. The pulmonary valve keeps blood going in the direction towards the lungs. From the lungs, the oxygenated blood enters the left heart chamber. When the left chamber pumps, the mitral valve keeps blood from going back into the lungs. Finally, the aortic valve keeps blood that was pumped out into the aorta from going back into the heart. Heart valves make your heart efficient. Valves over time, for various reasons, aging, infection, rheumatic fever, or an enlarging heart, can become either leaky or too tight. Leaky valves make your heart inefficient and can cause blood to back up into your lungs and cause shortness of breath. Tight valves cause your heart to have to work harder to get blood through the valve. This can lead to an enlarged heart and death. Depending on the valve, your surgeon will either replace it or attempt to repair it. Repair involves using stitches on the valve flaps and tightening it down by placing a ring around it. If it is replaced with an artificial valve, you will have to decide with your doctor if you want a mechanical valve, which lasts longer but requires you to be on blood thinner, or if you prefer a tissue valve, which doesn't last as long but generally doesn't require blood thinners other than aspirin. Generally, elderly patients should have a tissue valve for the most part, but the decision is made on an individual basis. Following surgery, patients have drains and IVs left in place for a couple of days. These are removed as your condition improves. Discharge from the hospital usually occurs in 4 or 5 days. At home, you will need to take it easy for the first month. Walking and breathing exercises are important. Monitoring your weight for fluid buildup and making sure your wounds are not red or draining will be important. By the 2nd month, you should be back to normal activity, such as driving, with the exception of heavy lifting or hunting. These activities will need to wait until you are 3 months out of surgery. Thanks for watching. Stay healthy and happy.